My name is Aaron Ford. I'm a physical therapist in Tupelo. I have a clinic on the west side of town. I just wanted to go over a few range of motion and safety transfer type deals with you guys, just so you can get a feel for what you're actually supposed to be doing with those things, what the intent of those particular movements and exercises are, and also when to refer when you actually need a little bit of help with those deals. So one of the deals that we work on here is during this time, of course, and when we're getting close to folks, we're wearing masks and that type of stuff. And I'm sure you've been trained on that kind of stuff, frequent hand washing, and also keeping yourself healthy. And that's, getting plenty of rest at night, drinking plenty of water, exercising regularly, eating healthy, those kind of things that you can work on to keep yourself healthy to prevent transferring things onto patients. That's throughout the year, not just necessarily during this time. So anyway, we're going to go over some of those things here. I've got a patient here with me, and we're going to go over range of motion of the shoulder, hip, and knee. We're also going to go over some proper ways to transfer people, proper use of a gait belt, and that type thing. So if you got any questions about these kind of things, just reach out to me. Also, obviously, the stuff that I teach you, you may have been taught a little differently in school or in training, and I'm not going to supersede any of those kind of things, but maybe just some tips that you can implement to what you're already doing and what those people have trained you to do initially. So no need to change any of those kind of things. But you need anything, just let me know. Thanks. Hey, so we are going to talk about how to do some range of motion safely for somebody. And so we're going to talk about, let's just say we got you got a patient that's lying there, in the bed or in the recliner or something like that. We're going to go over shoulder range of motion. All right, the shoulder's got 4 different motions. We got flexion, abduction, internal and external rotation. All right, so we're going to go over that. And then after that, we're going to go over hip range of motion, and then we're going to go over knee. That's probably the most common ones that you'll see. So anyway, we're still doing the 6-foot deal here. So anytime I get within 6 foot, I'm wearing a mask with folks. So anyway, my patient's a good guy. He's got a mask on. So anyway, if you can hear me here, we've got I've got some stuff here, and I'm gonna take him up to really about end range there. Not really going much past there, just right to where I feel some resistance, and then taking it back off. So about right there and back down. And I may do that, maybe 20 or 30 times or so. Yeah, just about right there. Good. You can see I've just got a pretty good grip on him here, but not squeezing too hard. Then we're going to go out to the side, and I like to put my hand on his shoulder here just to kind of feel. So we'll go up and down there. I've got his palm up towards the ceiling there, and he's just going up just to where you feel some resistance, and then going back down there. So we're going to go over internal and external rotation. All right, let's bend your elbow here. We're going to go back and there. Good. And this one's kind of a little tough for folks to do, so don't push it hard, just a little bit, and then down. Now I'll do 20 or 30 of those there. Then we're going to do internal rotation. That shoulder is actually rotating in, and the hand is going down. So, and this shoulder girdle will come up a little bit, and that's okay. Shoulder's a little tight, but it's loosening up a little bit. Yeah. And sometimes I just wiggle it a little bit like that just to help them relax a little bit. Sometimes you can rub on it, massage a little bit, and then anyway, and I'll put the arm back down there. All right. So we're going to go over some range of motion of the hip here. Okay. And so the hip has a few different motions, but we don't go over all of those. We just go over the major ones. So if somebody's had a hip surgery or a hip replacement, they've had a fall and broken their hip, you want to be very gentle with these movements, and some of these movements you'll want to avoid totally. So the surgeon, he'll write on there, he'll say avoid whatever. If you have trouble and you don't know, hey, what do I avoid after a hip replacement where they've got a scar right here? Should I do this movement or not this movement? Just get with me and let me know there's some movements that you want to avoid. But mostly any of them, as long as you're gentle and you're slow and you're just moving it around, it'll help move some of the fluids out of the joint, help with swelling and that kind of thing so they don't get too stiff. So, so we're going to go over flexion. We're going to do a little bit of abduction. We're going to do a little internal, external rotation. That's where you really want to go easy with, is the internal, external rotation. So anyway, here we go. I'm going to do a little hip flexion here. It's important to make sure his knee is bent right here. That way you take the hamstring out of it. So I'm just taking it here, just up and down. Good. Just like that. So, hey, so while I'm here, it's important to make sure you move your body and not do this kind of stuff, okay? You got to protect your own back. So I'm moving my body here. I got his leg up against me, just like that. All right, so there we are. There's flexion. We're going to go over abduction. So I'm going to bring it real easy out to the side there, okay? This is something you want to be real easy with this. Easy out to the side and back. Good. Just like that. All right, we're going to bend the knee. All right, now I'm going to do internal rotation and external rotation. Basically like a little upside down windshield wipers here, okay? Just in and out, just like that. Remember, keep this knee about 90 degrees here. Good. All right, we're going to put it back down. All right, we got one more thing to go over as far as range of motion is concerned. We're going to talk about knee. All right, recent knee surgeries. No, you don't have to crank on it and push on it hard, but if they've had knee surgery, they really need to be moving this thing, and they need to be moving it frequently. And think more repetition versus a load, right? So don't really put a ton of load on them, but just do little low loads over time. So I'm saying maybe every hour, every 2 hours, they need to be doing about 15, 20, 30 of these little deals, okay? So here we are, here we're gonna go over, these only got two motions, extension and flexion, okay? So we work on both of those. So obviously extension is being straight here, okay? And then we can bend the knee a little bit. Be sure not to pull this up too much because the hip will go into play there, but we'll bend this knee here, just like that, and then back down. Sometimes I'll just take off their shoe and just let them have their sock just up and down, just sliding their heel on the bed or something there. So anyway, up and down, just like that. All right, good. Take a break. There you go. Cool. Hey, so I'm going to talk about something that's very, very inexpensive that you may or may not use, gait belt. Okay? Anytime you're transferring somebody, walking around with somebody that you think is unstable or whatever, this right here, maybe 10, maybe 20 bucks on Amazon, it's worth every penny. So I'm going to show you how to properly put this thing on, where to put it, and how to help with somebody that's walking or transferring there. Okay, so you really shouldn't, if they require a lot of assistance, you know, you may need to ask for help. But anyway, we're gonna put the gait belt on here. So I've got my deal here, and I'm gonna undo this, and I'm really gonna put it about right here. That way I don't cut into his belly, but I've got a good support here. Not too high to where it's under his shoulders either. I can get a good handle there. So anyway, I'm gonna reach around you here. I'm gonna put this on you. Go ahead and lift that arm up. There we go, perfect. So I got it pretty snug on there, but not too tight. I'm just going to flip this back just for a little quick release here. So anyway, I'm going to ask him to scoot out to the edge of the seat if you don't mind. And you use your hands to help you, and we're going to stand all the way up. So I've got my hand back here. I don't know if you can see my deal here, but I got my hand here. Sometimes, go ahead and sit back down if you don't mind. If they're having some trouble, I'll come here, and I'll hold on right here, and go ahead and stand up if you don't mind, and I'll help him stand up that way. That's why I'm in front of him. That way, if he falls, I'm on in there. But anyway, let's just swivel that way and have a seat. There we go. Perfect. Good. So standing up and sitting down, I always tell folks, back up to where your leg hits the chair. That way you know you've gone back far enough. Using your hands to help you, not on the walker pulling up, but using the chair. So, hey, thanks for watching those videos. If you got any questions, reach out to me. One thing I do want to touch on is when to know if you need to refer to refer to a physical therapist or ask a doctor about a referral or something like that. So, physical therapy, we can, as long as we've got an order from the doctor, which is not hard to get. Sometimes we can call the doctor, sometimes you can get an order or whatever. As long as they've got someone to bring them, their Medicare will cover it. If they got Medicare and a supplement, they usually are not going to pay anything. It covers therapy, which would help you be more comfortable transferring them. We could teach you on a case-by-case basis. We could say, hey, Mrs. Jones needs to do this. You need to do this with Miss Jones, but Mr. Smith, hey, he'll be okay walking around the house without a cane, as long as you're there with him, that type of thing. You can get an evaluation if you need some help that way. Also, if you've got something you're not quite understanding, or you've got a patient and they're like, man, it's really killing my back to move this guy or this lady, from the bed to whatever her quality of life is down, that type of deal, you may want to reach out and see if a therapy consult is warranted at that point. So, the easiest thing to do really is just pick up the phone and call me. You can Google or Facebook. You can, Aaron Ford Physical Therapy, and ask a question about those kind of things. You can just reach out to me directly, or message through Facebook or Instagram, that kind of deal. If you're worried about what you need to do at that point, or some people that you work with, and see if that is an option for you to refer to therapy. If they have that particular need. So again, if you've got a need, let me know. I hope you enjoyed the videos, and I hope that it will be helpful to you to save you and make your patient more comfortable at home. Thanks.